Hey there. Gosh, sorry everybody. A little bit late. I reminded myself this morning of, let me see if I can, how do I want to be here? Uh, I think I'm good, but it doesn't look right to me. Okay, that's better. Okay. Hi there. So, yeah, it reminded me of getting in here a little few minutes late, like I usually do. This morning I was watching Fox News and they were talking about Will Kane was on there, like being in, well, because they started with a new host. Anyway, saying that Rachel Campos Duffy, right, usually is late and she's like just getting over to the couch as the Star Spangled Banner is playing. And I'm like, oh, that sounds like me. So I'm usually like stuck at a traffic light when I should be here. But anyway, doesn't matter because you're here and I'm here and got a great program today. I think very interesting on blood thinners, blood thinning medication. But before I get going there, I just want to say, introduce myself. My name is Rebecca Becky Montrone. I'm a holistic healthcare practitioner with a degree in holistic nutrition from Clayton College of Natural Health many moons ago. I have certified by the American Association of Drugless Practitioners. So I counsel people on all type of health problems. So I work with people of all ages. So it might be preconception, pregnancy, prenatal, pediatric, people of all ages, and health problems of all kinds. I kind of consider myself think of myself as a health detective. So it's not that I know everything, but what I don't know, I am always eager to learn more about. So anyway, we have a practice here on Roxbury Street in Keene, New Hampshire, in a beautiful old mill building called the Miller Forge Building. Excuse me, up on the third floor. Excuse me, I'm gonna clear. Up on up on the third floor. We are open 9:30 to 5 Monday through Friday. If you pop up, what might you find? You will find a really fun space with a lot of my herbal formulas. I'm also a full herbalist and I have a lot of formulas that we bottle and skincare line, a lot of supplements, nutritional supplements that I carry. Specifically things that I tend to use heavily with my clients, but also open to the general public and available here. 9:30 to 5, our phone number 603-439-2603. And I also have an online store, shopwondrousroots.com, so you can see everything we have there. We ship all over the country and the world. Recently shipping to places like Saudi Arabia and Israel and London, England many times, and goodness, Australia. We have different products that people are looking for. Some things that usually they can't find elsewhere. One of our really popular products is my really simple but very effective formula, Shrink That Thing for hemorrhoids. So we ship that all over the world, and then also our eye drops, our Wondrous Eyes MSM eye drops, and the different variations there that people are having a hard time finding elsewhere. So anyway, and then I have a lot of clients around the country or whatnot who order their products from me and whatever. Check it out, shopwondrousroots.com. If you want to check out what my real passion is, well, I mean, I love making the products and coming up with the formulas too, but education, learning, doing this kind of thing. This is like so fun for me. It's so I have another whole website that's more dedicated to that, and that's wondrousroots.org. I'm going to be taking you there in a few minutes just to show you a couple things, but anyway. Okay, I think that's, oh, you can reach out to me, contact us on either shopwondrousroots.com or wondrousroots.org. We also have a Rumble channel, Wondrous Roots, and a YouTube channel, so you can easily find us there. Sign up for my newsletters, and then you'll get an email prior to each webinar. I'm also going to be doing a lot more blogging, so I'm kind of wondering how I'm going to deal with that because I think I might even do like a daily blog, and people might get weary of me popping up in their email box every day, but I'll probably just start out using everyone. And then, or maybe I'll give an opt-in or something for just the blog feeds. I hate it when I get slammed with stuff like every single day that I don't want to see. So anyway, more on that to come. All right. Okay, so the reason I'm doing this program today is because, oh, and by the way, today is September 20th, 2025, is because I have had a client who it's just kind of she's been in a real, fell into a kerfuffle, like a health kerfuffle. Um, a few months ago, where she's, she's just turning 70, but I mean, she's lived a very healthy life. She's a physical therapist, she's an athlete, she's a rock climber, a hiker, and she ended up with these really debilitating pain symptoms and found out she has polymyalgia rheumatica, which was very hard for her to get on top of that inflammation. And she's been on prednisone and whatnot. But anyway, due to some of the medication she was on, she ended up with, she typically will get irregular heartbeats, but nothing like AFib or anything like that. And what she did was, she had one weekend, she felt odd. And she went into the ER and they said, oh, you're in atrial fibrillation and stuff. So they put her on Eliquis. So now she's on another medication. She's gone her whole life without medications, and now she's on prednisone and something else for that, and whatever. And they want to put her on bone drugs and all that kind of stuff. So she's kind of got caught into that pharmacy trap. But so anyway, she hasn't been on Eliquis that long, but we were talking about it, and I told her, I said, the new Weston A. Price Wise Traditions edition, their latest issue, which I had brought home and hadn't read yet, had a whole long article on what we call the direct oral anticoagulants, the DOACs. They're different than like our original heparin and then Coumadin, warfarin, and now we have these. And so the ones I'm talking about are like Xarelto, Pradaxa, but the most famous one right now is Eliquis. And I did a program, a radio, when I was back on the radio on WKBK several years ago. Joe, you will remember that. I don't know if you'll remember that program, but you remember the radio program anyway. Um, I did a program on Eliquis, and but it was different. It was kind of different. It was like talking about the proteolytic enzymes, which I'm going to do again. But so anyway, I read the article and I thought it would be good to bring that information to you. So to participate, I would love to have your participation. You can raise your hand and speak. You can type in the Q&A, or you can type in the chat. And I think most everybody with me right now are veterans. So anyway, you'll be good with that. Okay. So without further ado, I'm going to, I think while I'm sitting here with you, I will pull up my presentation. And I really enjoyed last week's presentation because of the whole way the nose to tail diet mimics what we do with supplements for methylation, right? And which is so important. So anyway, actually, towards the end of this presentation, I'm able to pull that in a little bit because it does factor in. So I'll just kind of whet your appetite with that, or maybe not, or maybe you're like, oh no, she's going to do it to us again. Okay. Anticoagulation. Okay. Down a little bit. Okay, I'm just getting my screen set up here, and then I will share. Oh, that was another thing. I got here and I opened up Zoom, and they changed their whole thing and I couldn't find my webinar. Oh, thank you, Katie. Thanks so much. She says, thank you for my generosity. Like, I don't even feel like I stayed up till I sent my newsletter out right after I finished this morning at about 4:30 in the morning. And at around 10 o'clock when I went in to start it, I didn't even really know what I was going to be talking about today. And I had such a blast. So you have to understand, like, this part of my work is such a self-indulgence. It's what I absolutely love. And then finding like images to go with my informational slides and stuff. It's just like, and it's quiet, right? No interruptions. It's just peaceful. So anyway, thank you. But it is more than my pleasure. And I love, what's the fun of knowing helpful information if you don't share it with somebody? You know, it's like, that's terrible. Okay. It's a terrible feeling. All right. So I'm going to share. Um, Here we go. And then put you guys over here and my chat over here. And yeah, you should be able to see that pretty well. And anticoagulant. Anticoagulants, yeah, the new class of blood thinners. So they're not that new. We've been using these since like 2010. They've been being used, but they're new compared to what people had been using. And we're not that far away from the warfarin days. And warfarin is not used now. It's just used much less frequently. So anyway, what you need to know. What prompted this topic, and I just told you that. So this is the article that when I have this up on my website, and where I will be going with this is, I'm just going to take you right now to my web page. I mean, my website. And that will be going here. Whoops, let me just see if I can bring this down. Heart Health Cardiovascular. So I've already got a couple of webinars on this page, but this is going to get posted here later today once the video is up. And I'll be showing that on here. But anyway, this is what you can see. Last week I did again, like, if you go here to say you're like, Becky did a presentation on eggs, but where am I going to find that? So you would go there, right there, and cholesterol in the brain, cracking the egg myth, right? You can find things eventually if you search there. Okay. All right. So back to blood thinners. This takes you to the Weston A. Price article that I'm going to be like kind of walking you through sort of without reading the whole article word for word to you. But again, when you have this as a PDF on that page, on the heart cardiovascular page, like I always put the PDF, you'll be able to open up the PDF, click on it, and get this link too. Okay. Yeah, Weston A. Price, my hero. Wonderful guy. We talked about him quite a bit last week, and with eating the whole animal. Okay. Oh, yeah. And for breakfast, I've been having this week my 2 eggs, right? And then I have a really nice, clean pate, and about probably, okay, like a good amount, like probably a third to 2/3 of a cup on cut up pear slices. So between that and my 2 eggs, I probably with my breakfast am getting about, probably over 600 milligrams of choline a day just in my breakfast. And then that for a woman, you want to be getting 450. I would say minimum. So brain food, right? So good for you. And anyway, I do these things and then I practice them. Okay. Why anticoagulants are used. I mean, that's just kind of obvious, but blood clots, right, can cause strokes, heart attacks, pulmonary embolism, like a clot in the lungs. Anticoagulants or blood thinners are prescribed to prevent or treat clots, especially after atrial fibrillation, joint replacements, or heart valve surgeries. About 8 million Americans take them. Hospitals use them for about a third of all patients. Okay, risk, deep vein thrombosis, DVT, blood clot, right? pulmonary embolism together, venous thromboembolism, VTE, which affects 900,000 Americans yearly, and 100 to 300,000 Americans die of these issues. So it's significant. We need to be able to control blood coagulation, that's for sure. And that's not the argument here, or the warning. So life-threatening blood clots, thrombosis is again a quote from that article that's in the Weston A. Price Wise Traditions, are associated with events like stroke, heart attack, pulmonary embolism. To break down existing clots or prevent clots from forming, doctors rely heavily on a pharmacopoeia of anticoagulant and antiplatelet drugs, together colloquially referred to as blood thinners. As commonly prescribed medications, doctors frequently recommend them for individuals with atrial fibrillation, often a precursor to coronary thrombosis, or for patients undergoing elective surgery such as knee or hip replacements or heart valve replacements. 8 million Americans take prescription anticoagulants, and hospitals routinely administer them to a third of all patients. So this is one thing, and I'm kind of taking a little detour here from the paper there, just talking about why is stroke a risk factor if you have AFib, right? You've heard that, but maybe nobody's ever explained to you what happens and how you're at risk if you have atrial fibrillation as you're going in and out of what they call cardioversion. Your heart flipping out of rhythm into a fibrillating rhythm, or back into normal sinus rhythm. So when the heart is in atrial fibrillation, the upper chambers, the atria, quiver instead of contracting strongly. Because of this, blood isn't pumped out efficiently and can pool in pockets of the atria, especially in the left atrial appendage. Pooled, stagnant blood increases the chance of clot formation. If a clot breaks free, it can travel through the bloodstream to the brain and block an artery, causing an ischemic stroke. So in short, atrial fibrillation leads to irregular heartbeat. Atrial fibrillation is a regular heartbeat, which leads to blood pooling in the atria, clot formation, risk of stroke if a clot travels to the brain. So it just puts you at a greater risk as you go in and out of cardioversion. I'm going to be talking next week about atrial fibrillation and how to prevent or heal atrial fibrillation in the first place, right? Then you have to think about what you're going to do to prevent having a stroke. Why atrial fibrillation increases stroke risk? Again, so said another way, atrial fibrillation, heart's atria quiver instead of pumping strongly, blood pools in the atria, especially the left atrial appendage, pooling, stagnant blood, clot formation more likely. A clot can break loose, travel through the circulation. If a clot reaches the brain and blocks an artery, you have a stroke. Now, I want to say, if you are right now on Eliquis or one of the other blood thinners, don't panic and say, I don't want to hear this because I don't want to know what I'm doing that's harming myself or anything like that. You are being medically managed. Be aware of things, as we go through, but don't stop taking your medication. Yeah, right, because we're going to find out that that's not a good idea to cold turkey any of that medication. So, yeah, don't worry. You're not at the end of, you haven't fallen off a cliff. Let's put it that way, if you're on those medications. Anticoagulants and the bleeding dilemma, right? The main side effect of the blood anticoagulants is you bleed too much. So you can have too little clots, too much bleeding. It's just hard to find the right dose. And that can be a real challenge for doctors trying to manage that in their patients. So kind of go back on a little bit of a anticoagulant timeline, a little history. We have heparin from the 1930s onward, and many of you may be familiar with that, going into the hospital for something and they gave you a heparin injection. Sometimes they would give heparin injections like every day if you were going to be in bed for a long time, because then you were at risk of developing a deep vein thrombosis in the calf, the lower calf or whatever, and they wanted to prevent that. So they give you a shot every day or whatever, maybe put it in, I don't know how they do it, maybe put it, I think it was a stomach injection, but anyway, doesn't matter. Unfractionated heparin, effective but unpredictable, requires constant monitoring, so usually done within the hospital setting. Low molecular weight heparin is more predictable, self-injectable at home. Both can cause heparin-induced thrombocytopenia, triggering dangerous clotting. Considered high-risk drugs. So these were nothing to play around with. And then there's the scandal in 2008 of the Chinese-made contaminated heparin that caused deaths, highlighting risks of overseas pharmaceutical manufacturing. And then we had warfarin or Coumadin, the 1940s and 1950s. That was the big one. And you know, really continuing right up until the 2000s for sure, until the advent of the DOACs. Derived from rat poison research. It inhibits vitamin K, and so the blood doesn't clot, and so it kills. If you give the rats enough of it, right, they just bleed out and die. Became the standard anticoagulant by the 1960s. High risk of over anticoagulation, bad interactions with other drugs, such as some antibiotics, difficult to monitor. Dubbed the most dangerous drug in America because small dosing errors can be fatal. You become the unsuspecting rat, so to speak. Adding aspirin to warfarin worsens the bleeding risk. Now, I think I'll wait for this story when I get in a little further. So I bet you're just sitting on the edge of your seat. I am. Vitamin K, warfarin, and heart health. Warfarin works by blocking vitamin K, which slows clotting. Problem, vitamin K isn't just for clotting, it's also essential for activating proteins that keep calcium out of the blood vessels, supporting bone strength. Those work hand in hand, right? We take vitamin K2 with D3 to make sure the calcium doesn't lodge in your arteries and in your blood vessels, right? Your carotids and your all over the place. You want all of that calcium to go into the bones, and you need vitamin K for that. So, I mean, it's just, really. So anyway, because that's what's the main constituent in arterial plaque, right? So maybe you don't have a stroke, but instead you have a heart attack, which I don't know, 6 of one, half a dozen of the other. Restriction of vitamin K. Calcium builds up in the arteries, vascular calcification, result higher risk of heart disease and arterial stiffening in patients on long-term warfarin. Blocking vitamin K may thin the blood, but it also weakens vessels and bones. Okay, so yeah, another downside. Now, patients on Coumadin, warfarin, were told, oh, you can't have any of these healthy foods, right? Leafy greens, spinach, kale, many herbs, seaweeds, other nutrient-dense foods, and don't have any of this, don't have any of that, pushing people, again, more towards the horrible crap diet, CRAP, highly processed foods, nutrient void, terrible. So your dietary recommendations were to eat poor food and avoid the healthy foods that you so vitally need. But back onto our timeline, we're at the direct oral anticoagulants, the DOACs, 2010s, this new class, Eliquis, Zaban, Xarelto, blah, 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 ban, Pradaxa, blah, blah, tran. And to directly inhibiting clotting enzymes, factor XA or thrombin. So prescribing has skyrocketed. By 2020, the DOAC use rose tenfold. So from 2010 to 2020. And warfarin use dropped. Oh, I want to get back to the warfarin for a second. I'm going to go to my page on heart cardiovascular again. No, I think I want to go to my serrapeptase page. Yeah, I do. Serrapeptase nattokinase, which are going to enter this discussion pretty soon. But here we go to this piece right here. Okay. Numerous health experts have been concerned for years that Coumadin was not effective in preventing vascular deaths, but also has problems with occasional serious internal bleeding episodes. German researchers found out in 2005 that long-term use of Coumadin produced increased calcium in the aortic valve and coronary arteries when compared to patients not taking Coumadin. Dr. Gary Gordon states that every patient on Coumadin is increasing the calcium content of all vascular tissues. The calcium content of arteries is now proven to be more dangerous than diabetes, elevated cholesterol, or hypertension. We must now try to educate patients. That's what we're trying to do here at Wondrous Roots. Right? Yeah. Okay, so anyway, Eliquis, which is Pfizer, there's two people who own the patent on Eliquis, and that's Pfizer and Bristol Myers Squibb. Dominate the market, heavily marketed, especially to seniors. So direct oral anticoagulants does not mean better. And the 2010s introduced further danger when pharma brought a new class of drug called the direct oral anticoagulants to market. The word direct refers to the fact that through the bio trick of fabricating small molecules designed to fit into the active component of clotting enzymes, like a key into a lock, the drugs directly inhibit coagulation proteins that naturally exist. Anyway, yeah, so it's either inhibiting activated factor X or thrombin. Is how those work. So the warfarin's working on the vitamin K, inhibiting vitamin K, and thereby clotting. And these are working through these proteins. And you can see Eliquis is a big pharma blockbuster. According to trade rag Fierce Pharma, Eliquis has been a reliable growth driver for its two owners ever since its debut in 2012 for atrial fibrillation, and then with expanded indications in 2014 for DVT, deep vein thrombosis, and pulmonary embolism. The drug's steadily rising sales gave it, as of 2021, when it was competing with COVID injections, the enviable status of being the fifth top-selling pharma product worldwide. It's huge. In the US that year, an estimated 4 million patients filled an Eliquis prescription, causing the drug to jump 15 ranks in a single year to become the 33rd most prescribed medication in the American market. By 2023, Eliquis had claimed 41% of the US anticoagulant sector, selling in as a preferred choice over options such as Coumadin and beating out Xarelto, despite the latter's earlier market entry. And so it raced to the top. So here's some key figures on the direct oral anticoagulant medication, Eliquis sales, and market size. So this is all, first we have Eliquis, 10 billion in 2022. US dollars, 3.2 billion in 1 quarter for Bristol Myers, up 11% year over year. The US billion globally, so US dollars, 44.3 billion globally in this drug market. And then forecasted market in by 2034, expected to reach 96.5 billion by 2034. That's big bucks. The pharmacy brand managers or whatever they're called, the PBMs, I can't remember what the B stands for, but they are the ones driving what your doctor prescribes most of the time, if not all of the time. Anticoagulants market overall in 2024, 35 to 36 billion, all anticoagulants, including DOCs and older drugs. Safety concerns, DOCs carry the FDA boxed warnings. Risk of spinal, epidural blood clots, and possible paralysis. Risk of stroke, pulmonary embolism when stopping abruptly, so yes, do not. say that's it, I'm not taking another Eliquis pill, do not. Consult with your doctor if you're wanting to come off. Do that under medical management for sure. Major bleeding, approximately 100,000 cases annually in the US and the European Union. Mortality remains high, even with reversal. We'll talk about reversal agents momentarily. Some studies show warfarin with careful monitoring may have lower overall mortality than these newer drugs. Lawsuits and antidotes. Pradaxa, Xarelto, Eliquis all faced lawsuits over bleeding risks. Eliquis initially had no antidote medication. Now, Andexa is available, but it comes with serious side effects and FDA concerns. Excuse me. Other reversal drugs, Kcentra, Praxbind, also have risky profiles. So they're for the other ones, right? So I think they use Kcentra with Xarelto and Praxbind with Pradaxa. Oh gosh, Pradaxa, whatever that is, that drug, the P one. Overall, antidotes are imperfect and sometimes dangerous. The antidotes are not like, oh, good, now I'm back into the safety zone. Oh, no. So anyway, going here, bleeding to death. The alarming scale of bleeding-related injuries and deaths experienced by patients taking one of the 3 leading DOACs has given rise to thousands of lawsuits with users alleging that the manufacturers intentionally understated the drug's risks. And I think that that's the important thing when you are in a situation where you're in a doctor's office, and you're being told you need to be on something, blood thinner and anticoagulation medication. Make sure that you get your questions answered. And because here we intentionally understated the drug's risks. And of course, understating the drug's risks, the manufacturers would to your physician as well. In 2014, Boehringer agreed to a $650 million Pradaxa, there's the P1, Pradaxa-related settlement to resolve over 4,000 cases. This was followed in 2019 by a paltry $775 million settlement for nearly 25,000 Xarelto-related lawsuits. J&J Bayer admitted no liability, but stated that their product liability insurance would help cover the settlement costs. Antidote side effects. So, Andexa for Eliquis and Xarelto. Serious side effects are common with this. Okay, so this is if you are bleeding out, you are in a serious state. They have something to give you to stop you from dying, right? Serious side effects or suffering issues that might lead to your death or disability, severe disability or whatever. Serious side effects of the antidote Andexa include anxiety, confusion, breathing problems, chest pain, fast heartbeat, swelling, dizziness, vision changes, weakness, speech, movement difficulties. I feel like a pharmaceutical ad on TV. Adverse events affect many body systems: cardiac, nervous system, immune system, respiratory system, hematologic system, and genitourinary. High mortality, up to 15% of patients died within 30 days, people who had to be antidoted with this Andexa. Kcentra used off-label for Eliquis and Xarelto. Risks include serious blood clots. So now you go the other way, you were bleeding out, and now we got you going with too many serious blood clots. Severe allergic anaphylactic reactions also reported. Praxbind is the antidote for Pradaxa. Side effects overlap with Andexa, similar additional risks: bone pain, seizures, hives, nightmares, sudden loss of coordination, coma. Stay out of the pharmacy if you can. We're going to get to how you can in just a minute. Key points: they're dangerous. Look before you leap. This is the other thing, right? As I was just saying, starting on a drug like Eliquis or Xarelto or Pradaxa, these are like, you can't just say, oh, I'm going to go on it for a week while I think about it, right? I'll go on it for a week or two and then I'll think about if I want to stay on it. No, make your decision before understand your risks and benefits and make that decision before you start that therapy. Starting DOAC therapy can feel like a one-way street. Stopping suddenly may trigger dangerous rebound clotting. Manufacturers even warn of increased stroke and embolism risk if discontinued. Patients can become locked in long-term, even when risks or side effects appear. So beginning a DOAC is not just a prescription, it's a commitment that can be difficult to reverse. Starting a DOC is like merging onto a busy highway with no easy exit. Once you're on, it's hard to get off safely. So make that decision before you get that prescription filled and start taking it. Also to consider quality of life, like it said further in that article in the Wise Traditions magazine. Patients live in anxiety, right? Because they're now afraid. They're on this, they're worried that these things are going to happen. And so now they have 55% of people on these medications are suffering with anxiety. Many avoid routine activities like gardening, exercise, shaving, cooking, traveling. So my client, who was the reason that prompted me to actually want to talk about this today, she was showing me like a big bruise on her arm from going rock climbing the night before, and then had a Band-Aid where it had happened prior. So just things that you're doing that you normally do. I mean, she didn't hit her arm like, oh my gosh, really hard. Oh, and I'll just tell you, my mother-in-law, she was on warfarin, and this was for atrial fibrillation years ago, and she just slipped on her, she tripped on a rug in her bedroom and fell. She ended up a month in rehab with a hematoma, we call it, a big, huge bruise that was hard up and down her whole entire leg. She had to be in a rehab facility with physical therapy and the whole 9 yards. Eventually, they just took her off the blood thinner. They didn't put her on anything else. She was fine until she died at 97. And this was probably 10 years or more earlier. And they found that these the anticoagulants in the nursing homes are a nightmare for many people. So yeah. So anyway, so people are like, I don't want to do that. I might, I always enjoy doing that, but I don't want to bang myself or, cut myself, God forbid. So lifestyle restrictions reduce your overall well-being. There you go. Ongoing issues. Prescribing continues despite risks driven by marketing and limited patient education. So this is hopefully helping in that regard. But you guys, I'm preaching to the choir anyway. Although some of you, Dr. Kathy, who's with us right now, had a stroke just about a year ago, and she's got to be on blood thinners. So Kathy, I'm not trying to freak you out. There are times when you've got to be medically managed and managed well, and she's under the care of the Mayo Clinic and getting really good care. So I'm not saying there's not a place for them, right? COVID-era clots, reports of unusual clots after COVID vaccines and infections increased demand for anticoagulants, especially Eliquis. And then liver toxicity, reports of DOAC-related liver injury, jaundice, hepatitis, not fully studied. So there's no perfect anticoagulant, safe, easy, effective, and reversible. Bottom line, blah, blah, blah. I think I've beat that. That's like, I just don't need to do that. What about the daily aspirin, right, you ask? Once hailed as a miracle drug for heart protection, still recommended by many doctors for prevention, but studies show mixed or negative results. Diabetics without heart disease, no benefit in preventing events. Prior aspirin use before a heart event, worse outcomes, more recurrent heart attacks. Women over 65, higher stroke risk, both ischemic and hemorrhagic. So that's, that's both because you had a clot, ischemic, and hemorrhagic because you bled out. Your blood's too thin. Even in some secondary prevention cases, risks remain high. So downsides of daily aspirin, you can see some of those there. And then there's another article published in Wise Traditions, Dr. Tom Cowan. And you can see there questioning the safety and effectiveness of daily aspirin use. If you're interested in more, again, that will be, the PDF will be available later. Natural alternatives. there we have the silkworm, the silk moth, and the silk cocoon. Serrapeptase, we're going to talk about some proteolytic enzymes, although I have to admit, I have always thought of serrapeptase as key, with nattokinase secondary when it comes to the clotting factor. But doing this program last night, I found out I've had that a little backwards. Are they both helpful? Yes, but now I would prefer nattokinase for the clotting. And so just goes to show you can teach an old dog new tricks. All right. A proteolytic enzyme, also called blah, 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 Serratia, bacteria in silkworm intestines. It dissolves the cocoon wall. I think that those are probably fine, Katie. She's asking about chymotrypsin and trypsin. I would think that's great, but I didn't delve into that this time. But you know what? I will for next week when I do my atrial fibrillation talk. I will look into those other things. There's other things too. There's herbs. There's pycnogenol, which is very good. There are other things, but today I'm just going to focus on these. Proteolytic enzymes, these two. Dissolves the cocoon wall, which suggests it can break down non-living tissue without harming healthy cells, which it can. Now produced by microbial fermentation, widely used in Europe, Asia, and increasingly in the US. It breaks down proteins, proteolytic, reduces pain and inflammation through three main actions. Thins inflammatory fluids for faster drainage, blocks bradykinin, a pain-triggering protein, breaks down fibrin, the protein central to clotting and scar tissue. So it definitely has an effect on hyperthrombosis through its work on fibrin in the blood. Absorbed via intestines, the lymph system, circulates in bloodstream, targets inflammatory debris. So we take it like an hour before you have any protein in the morning, right? So that way it gets right into your bloodstream, it gets out. Otherwise, it's going to digest your eggs in liver pate. It's not going to get out into your bloodstream. It's just you're going to just have a really nice, smooth digestion of what you just ate. How it works, the key therapeutic properties: anti-inflammatory, reduces pain, swelling, and tissue damage, safer than steroids or NSAIDs, with no delayed or adrenal suppression, clears inflammatory proteins and dead proteins at injury sites. So it's great for healing trauma in the body. It's great for neck and back pain, that kind of thing. Analgesic, inhibits bradykinin, which reduces pain sensitivity and soreness. Fibrinolytic and antithrombotic. So here we come to the whole clotting thing. Dissolves fibrin, reducing risk of blood clots, arterial plaque, and scar tissue. May help prevent heart attacks, strokes, DVT, and conditions linked to fibrosis, such as Alzheimer's, right? Endometriosis, a lot of fiber there, like fibroid tumors, fibrocystic breast disease. Anti-edemic. So it reduces fluid buildup, edema after injury or surgery. So serrapeptase is a great go-to if you've just broken your leg or something, right? Or sprained your ankle, or you name it. Health applications: respiratory health, improves mucus clearance, thins sputum, reduces neutrophil-driven lung inflammation, helps in bronchitis, sinus issues, mucus buildup. Cardiovascular health, breaks down plaque components, fat, fibrin, cholesterol, calcium, without harming healthy arterial cells, supports atherosclerosis prevention, and improved circulation. So definitely dynamic there. Arthritis and pain, large clinical experience, over 700 patients in one study, reduced pain, swelling, and improved recovery in both osteoarthritis and rheumatoid arthritis. Fibrocystic breast disease, shown to reduce breast pain, swelling, and cyst formation. Muscle inflammation, myositis, eases swelling, pain, and weakness in inflammatory muscle conditions. So really, for the musculoskeletal system, huge. And these other body systems. So it's a really good for your health. Practical use, again, as I was telling you, before food. And well, I'll show you because I've got pictures. Okay, bottom line, serrapeptase is a multifunctional enzyme with anti-inflammatory, analgesic, fibrinolytic, and anti-edemic effects. Okay, promising role. I won't read everything because we're running out of time. Meet superhero nattokinase. Nattokinase is an enzyme that comes from natto, which are fermented soybeans. Fermented soybeans, as long as they're non-GMO, by the way, natto is an acceptable soy food because the antithyroid or goitrogenic enzyme is phytate, I should say, is broken down through the fermentation process, like as in what's the other thing people eat? Tempeh, right? Yeah. Nattokinase is a remarkable enzyme with broad cardiovascular benefits. Derived from the traditional Japanese food natto, it has been shown to gently dissolve fibrin and support the body's own clot dissolving systems, helping to reduce the risk of dangerous blockages. Unlike synthetic blood thinners, nattokinase doesn't just target clotting. It also improves blood flow by reducing viscosity, lowers blood pressure, and helps maintain a healthier cholesterol balancing lipids. In essence, nattokinase doesn't simply prevent one problem. It works on multiple fronts to produce smoother circulation and a stronger cardiovascular foundation, one pill a day. Enzyme from natto, blah, 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 blah. Okay, breaks down, it's a potent fibrinolytic enzyme like serrapeptase breaks down fibrin, the protein that drives clot formation. 4 times more fibrinolytic activity than plasmin, which is the body's own clot-busting enzyme. Keeps blood from becoming sticky by improving viscosity, blood flow dynamics, which is super important, and your doctor never talks about blood viscosity, right? They talk about cholesterol and yeah. Unlike clot-busting drugs, such as urokinase and streptokinase, nattokinase can be taken by mouth, with effects lasting longer. Dissolves blood clots, reduces risk of thrombotic events, cleans arteries of accumulated debris, lowers blood pressure naturally, balances lipids, supports overall vascular function by improving circulation and reducing viscosity, stickiness. Viscosity is the stickiness of your blood. And it's important. The thickness or resistance of blood to flow. High viscosity, sluggish blood flow, higher risk of clots, heart attack, stroke. Low viscosity, blood too thin, higher risk of bleeding. So I guess stickiness wasn't really a good way to say that. The thickness, okay, so yeah, viscosity, how viscous is it? But I just think of thick blood as being sticky. All right. Strong correlations with cardiovascular risk, viscosity tied into all known factors, blood pressure, cholesterol, glucose, inflammation. Modifiable lifestyle, hydration, diet, and natural enzymes like nattokinase can improve blood viscosity without the harsh trade-off of pharmaceuticals. So it's wonderful, right? Because if you're like me and you're not on blood thinning and you don't have atrial fibrillation and you're not in that already on those drugs kind of thing, just get going here and protect your cardiovascular health. Okay, more on that. So the big picture, nattokinase is nature's clot buster. Long cultural history, modern validation makes it powerful. A powerful natural alternative to synthetic anticoagulants, pairs beautifully with serrapeptase. One focuses more on inflammation, edema, scar tissue, the other squarely on fibrin breakdown and circulation, although serrapeptase does break fibrin down as well. So let's look at kind of like their highlighted strengths. And this is the one I love by Doctor's Best, the one that the brand that I use for the proteolytic enzymes. And it's funny because that article that I was looking at earlier, that's what they recommended too. And I trust this one for these 2 supplements. This is the high potency serrapeptase, and that is 1 pill in the morning. Again, you can take it along with a nattokinase right at the same time. Okay. And then nattokinase, powerful fibrinolytic circulation booster, reduces blood viscosity, unsticks blood. Yeah, I was right. That's why yeah, okay. Cardiovascular protector, lowers blood pressure, reduces LDL, raises HDL, and I was actually going to edit that point out just to say that it balances your lipids, right? Not that we want necessarily always to reduce LDL or raise HDL, as we learned in the cracking the egg myth presentation of a couple of weeks ago. Clot prevention, heart and vascular health, blood pressure support, cholesterol balance. So really powerful. How long does it take for these to start working, right? You might say, well, gosh, I just got diagnosed with atrial fibrillation. If I start taking these, like how long is it gonna take for these to kick in? Nattokinase, studies show clot dissolving effects can begin within hours of administration. Because benefits are short-lived, it's best daily as a daily preventive to keep the blood flowing smoothly. That's not hard. Serrapeptase for pain and inflammation, relief may be felt quickly, even almost immediately. For blocked arteries and atherosclerosis, hardening of the arteries, 6 to 8 months for reliable results with continued improvement observed up to 18 months. So if you're going to take them together, if you're going to take just one and you want immediate results, go with nattokinase, right? If you're going to do both, do them both and rely on your nattokinase right up front. And then this will kick in and help with that over some time. Effects vary. And then transitioning away from prescription blood thinners should always be done, yes, again, under the guidance of the prescribing physician. That can be a tricky bridge. Not that you can't cross it, but it can be a little tricky. Now, let's think about the homocysteine methylation connection. And this is, again, me speaking. It wasn't covered in that article, but homocysteine is a key marker in cardiovascular risk. Particularly for hyperthrombosis, so thickening, clotting, hyperthrombosis, like forming clots. When levels rise, blood becomes more prone to clotting and blood vessels suffer damage that accelerates atherosclerosis. The body normally recycles homocysteine through methylation pathways. Okay, now you can see why I'm coming here. A process heavily dependent on nutrients like folate, vitamins B12 and vitamin B6. These B vitamins often best taken as part of a complete B complex. Yeah, because B2 and B1 play in there too, but work together to keep homocysteine in check and maintain healthy blood flow. Glycine also plays a valuable role by supporting methylation balance and acting as a buffer against excess homocysteine. Together, these nutrients provide a simple but powerful way to reduce thrombotic risk while also supporting overall vascular and metabolic health. Now, I drew this last night myself. This is like what I draw on my whiteboard all the time for my clients, but I get to stand up and wave my arms and everything. I would love to be able to like figure out how to do this and actually just have myself standing there talking to you and writing on a whiteboard. But anyway, for another day. But okay, this is that whole process by which we get around the MTHFR, the folate metabolism defects that more people have than don't. This DNA methylation is hugely important. And I was on a webinar with a live webinar with Dr. Goodnow this past Wednesday night on autism, which was also very interesting. And he was talking about DNA methylation. He's talked about it before. And so that's this part of things, right? That's so important. So what I do in my supplement regimen is I take MSM powder in the morning. It converts to cysteine and methionine. And then those amino acids are converted to SAMe. And SAMe, S-adenylmethionine, which is a huge methyl donor and is super important for us to be able to create methyl groups that attach now to every enzymatic process in the body and make them work properly. When we are getting these nutrients from food in the nose to tail whole animal eating diet, the methionine comes, and that comes from the muscle meat, the lean meat, your chicken breast or chicken thigh, whatever, your protein meat that people say, oh, eat the lean meat and don't eat too much fat and too much skin and all that kind of stuff. Organ meat. the organ meat, and I get these in my, I do that now too, but I mean, I rely on my supplements. I rely on my Thorne Basic Nutrients that has these nutrients in active forms. So you make sure you're getting those, right? And then homocysteine is formed from methionine, and then glycine, which is found, which I take as a supplement at night, is found as a powder, but it's found in the skin, the bones. Oh, Dale says, yes, I've seen that many times on your whiteboard. I'm honestly, it's on my whiteboard right now. If I could, oh my gosh, I should take my camera and just show you guys. Hang on. I'll try it. You see. Yeah, I can't really zoom. Whoops. Yeah, you can kind of see it there. There it is. Yeah, I'm drawing it all the time. It's my favorite chart. So anyway, glycine comes in. These B vitamins are breaking homocysteine down, but here's your other insurance is the glycine. So the glycine is what we find in the skin, the bones, and the cartilage in the whole food diet. If you don't have a defect in C677T, then methionine synthase comes in and helps break homocysteine down. And this process just keeps going around as you're eating a whole food, a whole animal diet, or as you're taking your supplements every day, which I would never rely on just my diet. I definitely need to do this because I have a homozygous MTHFR defect, which is very bad for my health. Okay, but what's the grand result of this? Glutathione is raised. Glutathione is raised by the combination of methionine from the lean muscle meat or from your MSM powder and glycine from your glycine powder or your skin, bones, and cartilage. They together work to break down, to raise glutathione. Whenever you see theo in science, right? Theo, methionine, glutathione, that means sulfur. It's all sulfur based. This is super important, and this is the key to how I fundamentally address the roots of health for every single person. If this is not happening for you, you're going to have health problems, and they can be severe. So I got to say it, glutathione, right? It's my goal. Every single webinar has to have glutathione. I have to be able to say it. So anyway, wrapping up, we've seen that anticoagulant drugs are often medically indicated, necessary, and at times truly life-saving, but they also come with serious, even life-threatening side effects. Being informed empowers you to make better decisions about what's right for your own health. And as for atrial fibrillation, if we can prevent or address that itself, then one of the most common reasons for prescribing blood thinners disappears. And that's a topic I'm going to delve into the next time. So I want to thank you all for being with me. I hope you have a wonderful weekend here in Keene, New Hampshire. It is gorgeous. It is 65 degrees, breezy, dry, and sunny. And it looks like more of the same for tomorrow. We've just been having a gorgeous patch of weather here, and I hope wherever you are as well. Thanks again. Thanks, Cindy. Thank you, everybody, for participation. We'll talk about chymotrypsin and trypsin next time, Katie. When I do the atrial fibrillation, we'll go into that and maybe some other ways to keep the blood flowing nice and smoothly, not too thin, not too thick. Okay. Take care, everybody. Let me see, stop my share. And I will say goodbye.